Hello, this is my diabetes presentation for Black Women's Health and Joy. We're just going to jump right into it. What is diabetes and what characterizes it? So diabetes is characterized by hyperglycemia, and that means that there are elevated blood sugar levels. And so I included a blood glucose chart to see the difference between what a normal person has for fasting, eating, and what a diabetic person, what their glucose levels would be after fasting, eating, and 2 to 3 hours after eating. And so on the right, that is the device on how blood sugar is determined. And so you just have to wipe the area down, you kind of prick it, get the blood, and the blood sugar amount will pop up on the screen. And so with both microvascular and macrovascular complications, they affect diabetic patients, both of them. And so for macrovascular, it's a result of acute complications, and microvascular is a result of chronic complications. So we're going to get right into the microvascular complications. What are they? So microvascular complications of diabetes mellitus is neuropathy, nephropathy, and retinopathy. So for neuropathy, basically for all of these really, the high glucose affects the blood vessels. And so long term, if the blood vessels keep on having high glucose in them and they're getting damaged, plaques in them, that's not really good. And so for neuropathy, numb extremities can occur because if there's that plaque in the way, if the blood that carries oxygen is not able to get to the extremities, less sensation is going to happen, especially over time. So nephropathy, the kidneys become unable to filter waste and excess fluid, so that's pretty bad. And for retinopathy, glaucoma and cataracts can occur because long-term effects of the eye blood vessels happen. Then for macrovascular complications, these are pretty bad. These are the ones that you really want to worry about because they are acute and they can lead to coma, death, stroke, just anything bad. These ones are really dangerous. And so again, for the brain, if you have that plaque build up, you're not getting any oxygen to your brain, and that can lead to a stroke. So for the heart, the insulin resistance, which is seen normally in type 2 diabetics, increases the risk of congenital heart disease. And then for extremities, the lack of blood flow means that there's no oxygen getting to the tissues, and you have impaired living, impaired judgment, impaired choices that you're making, really. It's just impaired everything if you're not getting the oxygen to the tissues. And so hypoxia can occur, and everything is just in a state of confusion. You don't know what's going on if you don't have that oxygen going to your extremities or brain. Then for insulin, I just kind of wanted to include this. Insulin is a hormone that the body uses to allow sugar to enter the cells and produce energy. And so as we know, food is energy, and it is pulled into the cells by insulin. That's another way of saying it. We have diabetes mellitus type 1. So what is it? What's the treatment? And what is associated with diabetes mellitus 1? So with type 1, you really only see about 5 to 10% of the diabetic population have it. And these diabetics are usually thinner. Most likely they are diagnosed during childhood. And if not, they have LADA, L-A-D-A, diabetes, and that's just late in adult diabetes. So these diabetics are dependent on insulin since their pancreas makes little or no insulin. And DKA means diabetic ketoacidosis. Since they don't have any insulin, or they're making too much of little insulin, they're making too little of insulin, their body needs energy, and so the insulin cannot help. So instead, the body pulls from the fat and the muscles, and the body makes ketones, and this is really bad because ketones can lead to comas. And then you pee all the ketones out, and you can get a really bad smell. It smells like nail polish, and so you know something's really wrong if you have that smell. And diabetic ketoacidosis in whole is not good for you. So that is what is associated with diabetes mellitus type 1. The treatment for this is taking the insulin, counting your carbs, fats, proteins, exercising regularly, and keeping the weight in check. And so normally with type 1 diabetics, you see them have the insulin pump in. Then for diabetes mellitus type 2, we're going to go over what is it, the treatment, what is associated with diabetes mellitus type 2. So really, most of the population that has diabetes mellitus type 2. And so with type 1, it's like genetic. Most of the reason why you can get type 1 diabetes would be from genetics. Type 2 would be because of environmental effects and just kind of like lifestyle choices. And so these diabetics are normally on the larger side, and they suffer from insulin resistance because if you're having too much sugar, which is hyperglycemia, in the blood, the hyperglycemia cannot be tamed by the insulin. So basically, you have too much sugar, and then the pancreas is saying, let's push out more insulin and more insulin and more insulin so we can feed the cells. But the pancreas becomes overworked and stops producing insulin in total. And so the treatment really is just exercise, weight loss, eat healthier. You can have weight loss surgery or oral medications like metformin. There's GLP medications and also injectable medications like insulin. And so that really is definitely something that would be able to help diabetes mellitus type 2 patients because, if they're not having levels of hyperglycemia, then the pancreas wouldn't be able to overwork itself, if that makes sense. So what's associated with diabetes mellitus type 2 is HHNS, which is hyperglycemic hyperosmolar non-ketotic syndrome. And so this diabetes type 1 had the ketones, this one doesn't. So it's the non-ketotic syndrome. And so this one causes severe dehydration. And you already know what happens when you're dehydrated, confusion. There's a lot that happens when you're dehydrated. But how dehydration happens with HHNS is the high glucose causes blood to be thicker and results in the body peeing out to decrease the glucose levels. And so if you're constantly peeing or sweating or getting rid of that fluid, you're becoming more and more dehydrated. And so that is definitely a big fear with the people that have HHNS is becoming dehydrated and dehydrated and dehydrated and having thick blood. So yeah, that's the end of this presentation. We went over diabetes mellitus type 1, type 2, the vascular changes, whether it be microvascular, macrovascular, or what insulin is. So yeah, it's a pretty neat subject for sure.